All right, lesson 10 tracers, radiotherapy, and targeted alpha therapy. So let's talk first about tracers. Radioisotopes are commonly used as tracers to identify disease in radiopharmaceuticals. The tracer allows the progress of the drug to be traced as it emits gamma rays from inside the body, which can then be detected by a gamma camera. Nuclear imaging has the clear advantage over X ray techniques in that it can be applied to soft tissue as well as to bones, and enables the internal functioning of an organ to be observed from outside the body. So, from the previous lesson, we learned about these radioactive substances, these radioactive elements that will decay and give off this gamma rays as well as alpha particles and beta particles. Well, we can use that as a tracer, as a way to see what happens in the body when you take one of these substances. So here are some examples. Iodine is a substance that is used by the thyroid gland, so radioactive iodine 131 can be used to image that specific gland. Glucose, made with hydrogen 3, carbon 13, or carbon 14, can be used to look at glucose in chemical reactions in the body. The tracers used in radiopharmaceuticals must emit gamma rays with enough energy to escape from the body and must have a half life just long enough for the scan to be complete before its decay. The one that is most widely used in diagnosis is technetium 99M. Okay, so this tracer must be used. The key point is with the half life that is long enough for the scan to be complete before its decay, because if it happens really quickly, then it doesn't tell you much about what's going on in the body. So we're going to take a quick look at technetium 99. So, why technetium? It is used in about 80% of all nuclear imaging procedures as it has the following advantages. So, the first, its half life is about 6 hours, which means that activity in the body stays high for long enough for metabolic processes to be examined by scanning, but also decays quickly enough to minimize the exposure to the patient. The second reason, its decay involves the release of gamma rays and low energy electrons. Without the high energy beta emission, the radiation dose is low. Low energy gamma rays escape the body and are accurately detected by the gamma camera. And the third reason is technetium is chemically versatile, so it acts as a tracer by bonding to a range of biologically active substances. These are chosen according to the organ to be studied. Okay, so three really good reasons why technetium has the most use of all other possible radioactive tracers. So technetium is not found in nature, and in fact, it is an artificial element that is generated in nuclear reactions from molybdenum 99, which decays to technetium 99. Okay, so we talked about that nuclear decay from the previous lesson. So, in order to make this radioactive isotope, molybdenum 99 has to undergo radioactive decay. So let's talk a little bit about magnetic resonance imaging, commonly known as MRIs. So MRI is an application of nuclear magnetic resonance, which is NMR spectroscopy, and so uses the fact that hydrogen atoms have a magnetic moment due to their odd number of protons. In the presence of a powerful magnet, radio waves are used to generate an electronic signal that can be decoded by a computer to produce 2 or 3D images. MRI is particularly useful in the diagnosis of living tissue because hydrogen atoms are present in water, which makes up about 70% of the body by mass. Okay, so you've all heard of MRIs. Some of you might have had an MRI done. They use this NMR technique to produce images in the body. So here we have an example of an MRI scan. This is the head of a male patient, which shows a bright red spot, and this is a cancerous tumor. Okay, the use of MRI allows doctors to look at the body to then determine the best treatment for disease. Right? Without the MRI, we might not be able to see this tumor. So, what are some of the benefits of MRI? MRI does not use ionizing radiation in contrast to other imaging techniques, so it is considered relatively non invasive. Radio waves are low energy waves, and there are no known hazards of the exposure of the body to the strength of the magnetic fields applied. MRI scans give detailed images of almost any part of the body and are widely used in cancer detection, the diagnosis of soft tissue injuries, and in monitoring degenerative diseases. MRIs are very common in hospitals, and you could see some of the ways that doctors use them nowadays. Now we're going to go into cancer, and we're going to talk about what cancer is and how to target cancers. Okay, so cells divide and replicate in a controlled manner. Cells will also kill themselves in a controlled manner known as apoptosis when damaged. Well, when you have cancer, this occurs when cells have been changed somehow and begin to rapidly multiply while also not dying, thereby forming a tumor. So, how do doctors go about treating cancer? Well, the biggest challenge to treating cancer is killing cancerous cells while not killing healthy cells. Radiotherapy cancer treatments take advantage of the fact that since they are rapidly multiplying, they are particularly vulnerable to damage by radiation. Chemotherapy agents also take advantage of this rapid multiplication and try to interrupt it, albeit in a non-specific way that can also target healthy cells. Surgery simply removes tumors and hopefully all the cancerous cells with it. Okay, so those are three really common ways that doctors have gone about treating cancer. Okay, chemotherapy is one of the most common ways, but it also has the disadvantage of targeting healthy cells. Newer treatments have come along, and those include targeted therapy, using agents to specifically target deregulated proteins in cancer, immunotherapy, activating the body's immune system to do the fighting for us, hormonal therapy, blocking the hormones that feed certain tumors, and angiogenesis inhibitors, which prevent growing blood vessels, thereby starving the tumors. Okay? So many different methods have been used to treat cancer, and there are many other methods that are being investigated and experimented with today. Radionuclides used in therapy are ideally strong beta emitters that also emit gamma radiation to enable imaging. Lutetium-177 and yttrium-90 are widely used on the basis of their emissions. Yttrium-90 is also increasingly being used in arthritis treatment. So let's talk about an example of an external radiotherapy, otherwise known as teletherapy. In teletherapy, an external source of radiation is directed at the site of cancer in the body from a radioactive source, usually cobalt-60. This undergoes beta decay, producing the stable product nickel-60. Now you can see the chemical equation for the beta decay. This reaction also emits gamma radiation, which is penetrating and damaging to cells, especially cancer cells. Okay, so you have the external source, and it's targeted at a specific site of cancer in the body, and therefore you damage and hopefully get rid of the cancerous cells. Linear accelerators are a more recent advancement in this targeted therapy. They are a type of particle accelerator in which microwave technology is used to accelerate electrons, which are then aimed at a heavy metal target to produce high energy X-rays, which are precisely directed at the tumor. So again, we're targeting specific sites in the body and then hopefully using the radioactive material to destroy those cancerous cells. Another new technique is something called the gamma knife. Okay, so gamma knife radiosurgery occurs when tiny beams of gamma radiation are focused on a tumor from approximately 200 cobalt-60 sources, causing a strong dose to be delivered at the site where the beams converge. Each beam provides a lower dose as it enters the brain, making for less damage. So those were all examples of external, where the source of the radiation comes from an external source. But we can also look at internal sources, and there are two that we're going to be looking at here. So we have brachytherapy. This involves putting a solid source of radioactivity into or near the tumor within the body. This is used to treat several types of cancer, including prostate cancer and cancers of the head, neck, womb, or cervix. Radioisotopes used in this therapy include polonium-103, which is a gamma emitter, as well as cobalt-60, another gamma emitter. Implants may be temporary, which means they are inserted and then removed later, or they could be permanent. Another example of an internal therapy is radioisotope therapy using a liquid that is injected intravenously or taken orally. Okay, so in these examples, the radioactive source is somehow taken and put into the body and then let it go to work. Okay, so as previously mentioned, it's taken in the body either as a solid form, as an implant, or as a liquid. Once it is introduced near the site of the tumor and left there for a period of time, then the gamma or the beta particles will be released and hopefully target those cells. Sometimes, however, this treatment involves the patient needing to be isolated while the implant is in place due to their emission of radiation. This could be potentially dangerous to others, so therefore they're going to be isolated by themselves. As previously mentioned, these radioactive liquids can be introduced orally or by injection. So some examples include phosphorus-32 is used for blood disorders. Strontium-89 is an example used for secondary bone cancers, especially for pain control. And then we've mentioned before, iodine-131 targets the thyroid gland, so it is used for thyroid cancer. So now let's talk about a new technique called targeted alpha therapy, known as TAT for short. So a promising development in this field is targeted alpha therapy, which is also known as radioimmunotherapy. This has the potential to be effective in the treatment of dispersed cancers, that is, those that have spread beyond the original tumor, a process known as metastasis. Okay, so cells that are normal will divide normally, okay, in a controlled manner. Cancerous cells will continue to divide, but they will not be controlled. So when it grows beyond the original tumor, this is the process known as metastasis, and this is a big problem because those cancerous cells could grow and affect other parts of the body. So targeted alpha therapy is a new technique that could be used. So this specifically uses alpha emitting radionuclides specifically directed at the biological target by attaching them to carriers such as antibodies. These carry the radionuclide to exactly the right place. Alpha particles are effective in this role because they have very high ionizing density, and so they have a high probability of killing cells at the target. And alpha particle radiation is short range and so minimizes unwanted irradiation of normal tissue surrounding the targeted cancer cells. Lead 212 is showing big promise for the treatment of pancreatic, ovarian, and melanoma cancers. So targeted alpha therapy uses alpha particle radiation because it can specifically target smaller areas and only target cancerous cells without damaging the surrounding normal cells. So here's an example of how targeted alpha therapy works. So they have a cancerous cell in the body. An antibody can be used that specifically targets to the antigen on the cancer cell. So it has a specific target in mind. The alpha emitter, so whatever the chemical or element that is radioactive is, such as the lead 212, that is directly attached to the antibody. And then once it is attached to the antibody, then the antibody can attach to the cancer cell and then destroy it using its ionizing radiation, using those alpha particles. Another experimental development is something called boron neutron capture therapy, BNCT. This is used particularly in the treatment of brain and neck tumors. Effectively, this technique generates the alpha particles at the target. First, the patient is given a high dose of the non-radioactive isotope boron 10, which concentrates in malignant brain tumors. This is followed by irradiation with neutrons of sufficient energy to be absorbed by the boron. This is the boron neutron capture. Okay, we can see this in the equation at the bottom, where we have the boron 10 and we're adding neutrons. The reaction is accompanied by the emission of high energy alpha particles, which are in position to kill the cancer cells in the tumor. So, by capturing these neutrons, boron 10 is converted into boron 11, which is then decays into a non-radioactive isotope, as well as producing alpha particles. And since we're in a malignant brain tumor, for example, those alpha particles can specifically target the cancerous cells near the brain. The targeted nature of this treatment depends on the extent to which boron 10 is selectively absorbed by the tumor and not taken up significantly by healthy cells. Other non-radioactive isotopes are being explored for possible application in this role for tumors at other sites in the body. This therapy continues to advance as new treatments become available. The whole goal of these targeted therapies is to exposure the healthy cells to radiation as well as limit the amount of toxic side effects. So here is an example of this boron neutron capture therapy, where we have a cancer cell near the brain, for example. It takes up the boron that is pictured in purple. The neutron is added, and the boron gets converted into the boron 11, and it will decay into the non-radioactive lithium, as well as release alpha particles and gamma rays. The alpha particles will target the cancer cells because they are ionizing radiation. So we have to talk about some of the side effects of radiotherapy. External radiotherapy tends to cause more general side effects than internal therapy. If improvements in radiotherapy processes have in many cases reduced the range and severity of the side effects of many of the treatments. Nonetheless, the side effects do occur mainly as a result of the effects of radiation on the surrounding tissue. The ionizing effects of radiation cause changes in the DNA of healthy as well as cancerous cells, particularly in those that divide rapidly, such as hair follicle cells. So, of course, you probably know one of the main side effects of chemotherapy, for example, is losing your hair, and that is due to the ionizing radiation. So, here are some other side effects that you should be aware of. Fatigue, rest and regular hydration are important. Nausea is quite common, especially when you're dealing with the digestive system. Hair loss was mentioned. It's usually temporary. The hair will grow back. Sterility is possible if the treatment is close to the ovaries or the testes. And skin reactions are also possible. They may become red, sore, or itchy in the local area of the irradiation. All right, let's take a look at some questions to wrap this up. 24A says, outline the characteristics of technetium-99 that makes it so suitable for use in diagnostic procedures. Technetium, like was mentioned, is really, really useful, and there were a couple of reasons why it is so widely used in these diagnostic procedures. Those include the half-life being about 6 hours, which is long enough for diagnosis, but it decays quickly, so it is not exposing too much of the patient to the radiation. And the radiation in itself is gamma rays, which are used for detection, as well as low energy electrons, which minimize radiation dose. The isotope is chemically able to bond to various biomolecules within the body. 24B says, state the characteristics of lutetium-177 and yttrium-90 that make them so useful in radiotherapy. So these were two other examples of radioisotopes that are used in these therapies. They are strong beta emitters that also emit gamma radiation to enable imaging. So all three of these radioactive isotopes are useful, but they do serve different purposes. Here we have 25A. Describe what is meant by targeted alpha therapy. So we just got done talking about what that is. Go back and check your notes, check the slides for targeted alpha therapy. The key word is alpha, so it uses alpha emitters attached to carriers such as antibodies, which specifically target certain cells. 25B, explain two characteristics of alpha particles that enable them to be particularly effective in cancer treatments. So, alpha particles, they are high ionizing density, so they have a high probability of killing cells along their track, so they can be really targeted. They have a short range and so minimize unwanted irradiation of normal tissue surrounding the targeted cancer cells.